Welcome back. This is the last course segment in our veterinary dental radiographic interpretation webinar. This will be an extended session. It'll probably run 90 minutes or maybe a little bit more, as we are going to be talking about miscellaneous clinical radiographic changes, and there are quite a few that we want to cover. And we're going to show mainly a radiograph and then actually ask you to sit back and think of what that might look like clinically in most cases. So we'll start off here. This is the right mandible on a young dog. You can see that the apices have not closed yet on these premolars. Here's the first molar, and take a look at that and see if you see anything abnormal. If you look closely, you can see that there's bone still dorsal to the crown on this first molar, which should be erupted prior to the premolars here. You can also see on the back part here, the extension of that bone going over the distal aspect of that cusp. And clinically, that's what we've got. This is a fibrous tissue that is present over the top of that first molar, and it's preventing that first molar, along with the bone that's encased over that crown, from erupting properly. So when we have that scenario, what we can do is what we call an operculectomy, where we remove a portion of that covering surgically. In this case, we used a scalpel, and we exposed that tooth, and then very carefully go in with a diamond burr and kind of paint that bone away from the crown. Now, the owner needs to know that there will be some changes in that crown in the enamel, because we have to get right on the enamel as we remove that bony covering. And so there will be slight changes there when this tooth does finally erupt. However, with the fact that the apices are not closed on those teeth, full eruption is likely and very possible. And there's what it looks like from the side, a little bit more of a lateral view as opposed to a crown to apex view. And there's the final product in the adult once eruptions occurred. And this was actually bilateral. Oftentimes they are bilateral. I'm going to show you that right mandible on this cat. And then we'll look at the radiograph. As you can see, most of this crown's been destroyed. We've got a small portion of the distal aspect of that crown that's still peeking up through the gingiva, which is represented here. But the majority of that crown has been destroyed. However, the roots are still intact, and we've got a nice periodontal ligament space around both of those roots. We kind of lose the continuity of the root here a little bit. However, when we're looking at this problem, which is tooth resorption, our diagnosis and our treatment is basically radiographic in nature. And we have to look at the individual roots and put them in a category which will allow us to make that decision on which way we need to go as far as therapy goes. And this would be classified as clinically as a class or as a type 1 tooth resorption. And type 1 basically means that we've got a nice periodontal ligament space around the tooth root. Generally, we have crown destruction with those, and for the most part, we've got discomfort because we get gingiva that moves into the defect and becomes inflamed and is uncomfortable for the patient.